Hello future dentists, welcome back to Exam Key Point Dentistry. Today's topic is conscious sedation, a very important periodontics and oral surgery topic that is frequently asked in BDS exam. So before we start, tell me in the comment, have you ever seen a child who was so anxiety that dental treatment become impossible? So what can we do in such cases? The answer is conscious sedation. So let's understand in its simple language. So first we see the definition of the conscious sedation. So it is a minimally depressed level of consciousness that retain the patient ability to independently and continuously maintain an airway and respond appropriately to physical stimuli or verbal command that is produced by the pharmacological and non-pharmacological method or combination therefore. So it is a minimally depressed level of the consciousness where the patient can maintain their own airway and responds to verbal command or physical stimulation. So think of it like this: patient is relaxed and calm, still awake, can talk, can respond to dentist, can breathe on their own, but anxiety is reduced. So here, question for you: is the patient unconsciousness during the conscious sedation? No, the patient remain consciousness. Now we see the classification of the sedation. So there are the 4 levels. So first one is minimal sedation. So here a patient is able completely respectively to the verbal command, and inventricular and the cardiovascular system completely unaffected. So it means patient respond normally to the verbal command, heart and breathing remain normal. Okay, so here easy memory is relaxed but fully awake. Okay, now the second one is moderate sedation. That is, here the patient become more relaxed, maybe sleepy, but respond to commands. So can this patient still respond? Yes. Now the third one is deep sedation. So here does respond to the verbal command but only after repeated or in the form of the painful stimulus. So here the patient respond only after repeated commands or the painful stimuli. Here the ventilatory function of the patient should be impaired. That is the air maintained. So here the breathing may become impaired. So here easy memory is patient is very sleepy and it should need careful monitoring. Okay. Okay, but the cardiovascular system is completely maintained. Now, the fourth one is general anesthesia. So, here the patient does not respond even to the painful stimuli. Both breathing and cardiovascular function may require assistance. Okay, so here the exam trick is conscious sedation is not equal to the general anesthesia. So, remember this difference. Now we see the objective of the conscious sedation. So why do we use it? So first, to reduce or eliminate the anxiety. So many children fear injection and dental instruments. So sedation helps them relax. Second one is patient cooperation. So a cooperative patient allow the better treatment. Third one is raise a pain reaction threshold. So here the patient tolerant procedures is better. Fourth one is reduce gagging. So it is helpful during the impression and the intraoral procedure. Now the last one, it helps in the treatment of the mentality and the physically disabled or mentally challenged patient like this. So here it helps in usually in physically disabled patient, in mentally challenged patient. So which reflex is reduced by the conscious sedation? The answer is gag reflex. Okay. Now we see the ASA physical status classification, which is very important for the exam. So first we see the ASA physical status 1, that is for a normal healthy patient. Okay, so example like a healthy child with no medical problem. Second one is ASA medical status 2, that is a patient with a mild systemic disease. Example like a controlled asthma. Third one is ASA physical status 3rd, that means a patient with a severe systemic disease. Example like a poorly controlled diabetes. Fourth one is ASA physical status 4, that means a patient with a severe systemic disease that is constant. Like severe disease that is a constant threat to life. Okay. Now ASA physical status 5th, that is a moribund patient who is not expected to survive. So here the moribund patient not expecting to survive. Now ASA physical status 6, that means a declared brain dead patient whose organs are being. So brain dead patient whose organs are being donated, that is considered as ASA physical status 6. Okay. What are the questions to ask before starting any procedures relating to the medical history and the drug use? So before the sedation, always ask the allergies, any drug allergies, or you can say previous adverse reaction. Okay. So allergies and previous allergies or adverse drug reaction, you always ask before the sedation. Current medication including dose, time, route, and site of administration. So you always ask before the sedation, what are the current medication these patient is going on. Okay. Now, any disease order or any physical abnormality, previous hospitalization. So, any previous surgery or admission is there. So, you always ask. Okay. So, why is medical history important? Because to prevent the complication during the sedation. Okay. Now we see the pre-operative preparation. So here the patient, parent, guardian or caregiver must be advised regarding the procedure and informed consent for the proposed sedation must be obtained. So we have to obtain the informed consent. Like parents or guardian must understand the procedure. Okay. Adequate oxygen supply and equipment to deliver oxygen. So here you always keep the oxygens ready. Okay. Now the third one is like pre-operating diet restriction must be considered. So it is very important here. We have to follow the fasting guidelines. So what are the ASA fasting guidelines? So your first one is clear fluid, that is like water, fruit juice, clear tea and black coffee. So here the patient should be fast around the 2 hours. Now the second one is milk. If it is human, then it should be patient will be fast around 4 hours, and if it is infant formula, then it was 6 hours. Okay. If there is any lightweight food, then the patient should be fast around the 6 hours, like fruits and vegetable he have taken or he or she have taken. Now the heavy food, that like a fatty meal or meat, so it should be around 8 hours. So how long should a patient fast after a heavy meal? That is a 8 hours. Now the most common sedative gas is a nitrous oxide. Okay. So it is also called the laughing gas. So what are the properties of the nitrous oxide? So first is it is a weakest inhaled anesthetic. Okay. Colorless, non-inflammable with a slightly sweet odor, low solubility in blood, rapid effect and is quickly reversible on discontinuance, can induce loss of consciousness at high concentration, typically 70% or higher. It produces either no change or a slight increase in blood. Okay, so it can cause slight increase in blood pressure. There is no effect on the heart rate. So it does not cause any heart rate effect. So now we see the mechanism of action. Now first we see the analgesic effect, which is interaction with an opioid receptor. So here the nitric oxide also promotes the release of the endogenous opioids, that is endorphins, and interact with an opioid receptor. So here it effect is it decreasing the pain perception and producing the analgesia. Okay. Now here we see the step-by-step explanation of the nitric oxide mechanism. So first here the nitric oxide is inhaled. Here the patient breathes the nitric oxide through a nasal mask. Then there will be action in the brain, that is a midbrain. So here the nitric oxide reaches the brain, especially in the midbrain, and stimulate the pain control center. Then after there was an activation of the descending pain pathway. So here the brain sends inhibitory signals down the spinal cord through the descending pathway. These signals reducing the transmission of the pain messages. Then after there was an involvement of the GABA. So here the nitric oxide enhance the action of the GABA, which is a main inhibitory neurotransmitter of the brain. So here it produces relaxation, it reduces anxiety and causes the sedation. Okay. So here the final result is anxiety will be decreased, patient become relaxed, pain threshold increase, mild analgesia occur, and conscious sedation is achieved. Okay. Now we see the contraindication when should nitric oxide not be used. So first, in case of some chronic obstructive pulmonary disease, in current upper respiratory tract infection, that is if it is blocked the nose, then it will prevent the proper inhalation. Third one is recent middle ear disturbance or in surgery like middle ear disturbance. Fourth one is bowel obstruction or the abdominal pain. So here the gas expansion can worsen the condition. Now next one is cobalamin vitamin B12 deficiency. So here the nitric oxide can affect the vitamin B12 metabolism. So why avoid nitric oxide is upper respiratory tract infection, because the patient cannot breathe properly through the nose. Now we see the technique of the nitrous oxide sedation. So here first step is that is inspection. So here inspect the equipment thoroughly. Okay. Step 2 is place a mask over the nose. Okay. Like this you have to place the mask over the nose. Third one is give 100% oxygen and for 2 to 3 minutes. Okay. Now fourth one is slowly introduction of the nitrous oxide. So you have to slowly introduce after giving the 100% oxygen. Now next step is encourage the patient to breathe through the nose. Step 6 is explain the sensation that they feel like a floating, gidding, tickling and the digits. Step 7, adjust concentration to 30% is nitrous oxide and 70% is oxygen. Okay. Now after completion of the procedures, give 100% of oxygen for the 5 minutes. So this prevents the diffusion hypoxia. So why give 100% oxygen at the end? To avoid the diffusion hypoxia. Now we see the clinical sign of the sedation. So how do we know sedation is working? So first one is like dazed stare, like dazed appearance, reduce eyeball movement, reduce rate of blinking, dropping of the upper eyelid, relaxed body and the shoulder, hand drop to the side, giggling or smiling, or you can say relaxed facial expression. Okay. So patient become calm plus relaxed and plus happy. Okay. So now here the exam quick revision is. So first we see the definition. Here the patient remain conscious and maintain airway. Here the objectives are anxiety reduction, better cooperation, increase pain threshold, reduce gag reflex. Common agent is nitrous oxide. Contraindication like COPD, URTI, ear surgery, bowel introduction, vitamin B12 deficiency. Ideal sedation mixture is 30% nitrous oxide and 70% oxygen. Okay. Now excellent work, future dentists. Now answer the question in the comment. Which gas is known as the laughing gas? If this lecture helped you, then don't forget to like, share and subscribe to Exam Keeper Dentistry. And I will meet you in the next BDS exam oriented lecture. So keep studying, keep smiling and keep saving teeth. Okay. Thank you.